I do see patients that have had surgery that has failed, or they've been in pain management, and sometimes for a long time. I see patients that I have to say, I'm impressed at the amount of medication that they're on. And so one of the questions I get is there any chance I can ever get off of the junk, essentially, and get my life back? And the short answer is yes. It depends a bit on what the actual problem is, what the solution is if it is a surgical issue, and a bit about the patient themselves. But I've been successful over a 20-year period of getting patients, even sometimes in the worst of shape, back to a normal or much more normal lifestyle.